Linda is 58 years old. Every morning she wakes up at 6, walks down the hallway, and helps her 79-year-old mother out of bed. She lifts her, she bathes her. She spoons oatmeal into her mouth because her mother's hands shake too badly to hold a spoon. Linda hasn't had a paying job in 3 years. She quit her position at the grocery store because no one else could take care of her mom. Medicaid is the only reason Linda can see her own doctor. It covers her blood pressure medication. It covers the insulin she injects every single night. Then one afternoon, Linda opens her mailbox. Inside is a letter from her state Medicaid office. It says she must prove she is working 80 hours a month or her health coverage will be terminated. Linda stares at the letter. She works more than 80 hours a month. She works every waking hour. But according to this letter, it doesn't count. If that scenario sounds impossible, I need you to hear me clearly. It is already happening. I am Edward, and I am a senior policy analyst specializing in retirement finance and benefits protection. For years, I have helped older Americans understand complicated government rules before those rules hurt them. Today, I am going to walk you through exactly what this new Medicaid work requirement means for the 7.3 million family caregivers in America who depend on Medicaid for their own health insurance. I will explain the law, the deadlines, and the exemptions, including one hidden legal protection that most people have never heard of. But I need you to stay with me until the end of this video, because there is one mistake, a paperwork mistake, that has already caused tens of thousands of people to lose their coverage. Even people who were fully compliant, even people who qualified for an exemption, and I am going to show you exactly how to avoid it. Let me tell you about Robert. Robert is 61 years old. He lives in a small town in Arkansas. For 30 years, he drove a delivery truck until his knees gave out and he couldn't climb in and out of the cab anymore. He started collecting a small disability check, but it wasn't enough to qualify for SSI or SSDI. He got his health coverage through Medicaid. Robert also takes care of his older brother who had a stroke 2 years ago. Robert drives him to physical therapy. He cooks his meals. He helps him get dressed in the morning. It takes Robert about 4 hours a day, 7 days a week. That is over 100 hours a month of unpaid caregiving. When Arkansas rolled out Medicaid work requirements back in 2018, Robert figured he had nothing to worry about. He thought, I'm taking care of my brother full time. Of course they'll see that. But Robert never logged into the online reporting portal. He didn't even know it existed. He didn't own a computer. No one from the state ever called him. No one knocked on his door. 6 weeks later, he received a letter saying his Medicaid had been terminated for non-compliance. Robert was one of more than 18,000 people who lost their health coverage in Arkansas in less than a year. According to the Kaiser Family Foundation, roughly 70% of those who lost coverage were actually working or qualified for an exemption. They lost their insurance not because they broke the rules, but because they couldn't navigate the paperwork to prove they hadn't. That was Arkansas. That was a pilot program. What is coming now is nationwide, and it is far more aggressive. Robert's story is not unique. It is a warning, and the lesson is simple. Knowing the rule is not enough. You have to prove you know the rule, on their terms, on their timeline. If you don't, it doesn't matter how many hours you spend caring for someone. The system will cut you off. Let me walk you through exactly what the law says, who it affects, and what the deadlines are. On July 4th, 2025, President Trump signed the One Big Beautiful Bill Act into law. That is Public Law 11921. Buried inside that massive spending bill is Section 71119, which creates what the government officially calls community engagement requirements for Medicaid. In plain English, these are work requirements. Here is what they require. Starting January 1st, 2027, and some states are starting even sooner, Every adult between the ages of 19 and 64 who receives Medicaid through the Affordable Care Act expansion must prove they are engaged in at least 80 hours per month of qualifying activity. That includes paid employment, volunteering, job training, or enrollment in an educational program. Now, 80 hours a month is 20 hours a week. That may not sound like a lot. But for someone who is 59 years old, with diabetes, COPD, and chronic back pain, and who is also caring for an aging parent, finding, documenting, and reporting those hours is an enormous burden. According to the Congressional Budget Office, 18.5 million Americans will be subject to these requirements every single year. 20 million people are currently enrolled in Medicaid through the expansion pathway across 41 states, plus the District of Columbia. Let me talk about the timeline because this is urgent. The Department of Health and Human Services is required to publish its interim final rule by June 1st, 2026. That is less than 2 months from today. Once that rule is published, states can begin implementing immediately. Nebraska has already announced a target launch date of May 1st, 2026, which has likely already passed or is days away. Montana is planning to enforce requirements by July 1st, 2026. The federal deadline for all states is January 1st, 2027, although states can request an extension through December 2028 if they demonstrate a good faith effort to comply. Now here is where it gets dangerous for caregivers. The law lists specific groups that are exempt from the work requirement. Those include parents or guardians of a dependent child age 13 and under. It includes people who are pregnant or postpartum. It includes individuals enrolled in educational programs. It includes people who are what the law calls medically frail, meaning they are blind, disabled, have a substance use disorder, a disabling mental health condition, or a serious and complex medical condition. And it includes caregivers of a person with a disability. But notice what is missing. If you are caring for your 80-year-old mother who has Alzheimer's and she has not been formally classified as disabled, you may not be covered by that exemption. If you are caring for a spouse who is recovering from cancer surgery or a sibling with chronic heart failure who hasn't applied for disability, the law, as written, may not protect you. This is the gap that affects millions of people. There are 63 million family caregivers in the United States. Of those, 7.3 million are adults between 18 and 64 who rely on Medicaid for their own health insurance. These caregivers provide an average of 35 hours of unpaid care every single week. The economic value of that caregiving, according to the AARP Public Policy Institute's 2026 report, exceeds $1 trillion per year. That is more than all federal, state, and local Medicaid spending combined in 2024, which totaled $931.7 billion. And here is the part that should concern everyone. If you lose Medicaid because of non-compliance with the work requirement, the law explicitly bars you from receiving premium tax credits on the ACA marketplace. That means you cannot fall back on an Obamacare plan. You lose Medicaid, and you lose access to affordable insurance entirely. It is a double lockout. Let me give you the numbers that show how this plays out for older adults specifically. According to a study published in the Journal of the American Medical Association by researchers at Yale School of Medicine, approximately 1/3 of the 5 million adults at risk of losing Medicaid due to these requirements, roughly 1.7 million people, are between the ages of 50 and 64. 2/3 of that group have 3 or more chronic conditions. 1 in 5 takes 5 or more prescription medications. Dr. Alyssa Chen at Yale School of Medicine put it bluntly. She said, "Those medications just go away if they don't have Medicaid." That means untreated chronic conditions like hypertension and diabetes, which could mean having a stroke or kidney damage or a heart attack. These could be preventable if people stay on Medicaid. And there is one more consequence I need you to understand. The Kaiser Family Foundation reports that among Medicaid enrollees age 50 and older, 28% live in food-insecure households. 45% also receive SNAP benefits. In many states, Medicaid enrollment is used to determine SNAP eligibility. So losing Medicaid doesn't just mean losing your doctor. It can also mean losing your food assistance. Now let me tell you exactly what you need to do. I have 3 steps. If you are a caregiver, if you are over 50 and on Medicaid, or if you know someone who is, write these down. Step 1. Find out if your state is implementing early and document your caregiving now. Do not wait for January 2027. Nebraska and Montana are already moving. Your state could be next. Go to the official CMS community engagement page at medicaid.gov. The direct link is in the description below this video. You can also call your state Medicaid office and ask 2 questions. When is my state implementing community engagement requirements? And what documentation will I need to prove an exemption? Start building your paper trail today. If you are a caregiver, write down who you care for, what tasks you perform, and how many hours per week. Get a letter from your loved one's doctor confirming their condition and your role. Keep copies of pharmacy receipts, medical appointment records, and any hospital discharge paperwork that names you as a caregiver. AARP's Public Policy Institute has identified 12 different data sources states could use to verify caregiver status, but until your state builds its system, the burden is on you. Step 2. Understand and assert the RAISE Act exemption. This is the hidden protection. The new law, Section 71199, does not just list exemption categories on its own. It specifically cross-references the RAISE Family Caregivers Act, which was signed into law during President Trump's first term. The RAISE Act defines a family caregiver as an adult family member or other person who provides assistance to someone with chronic or other health conditions, disabilities, or functional limitations. That definition is far broader than caregiver of a disabled person. It covers people caring for someone with Alzheimer's, cancer, heart failure, COPD, or any chronic health condition. AARP and the Caregiver Nation Coalition have formally urged CMS to apply this broader definition when writing the regulations due in June 2026. If you are a caregiver and your state tells you that you don't qualify for an exemption, cite the RAISE Family Caregivers Act by name. Ask for a fair hearing. Contact your state health insurance assistance program, known as SHIP, at shiphelp.org for free counseling. And contact AARP's advocacy network, which has already mobilized 115,000 messages to Congress on this issue. Step 3. Never assume compliance. Always report and confirm in writing. This is the lesson of Arkansas. 70% of the people who lost coverage were eligible. They just didn't report. Once your state launches its system, report your hours or your exemption status every single month, even if the state only requires verification every 6 months. Do not rely on the state to automatically verify your status. Keep a copy of every submission, every confirmation number, every email. If you submit by phone, write down the date, time, and name of the person you spoke with. If you are ever told you are non-compliant, you have 30 days to respond. Use every one of those days. Request a fair hearing immediately. Do not let a single deadline pass without a response in writing. I want to be honest with you. What I have shared today is just the beginning. The HHS regulations that will define exactly how this works, including whether the RAISE Act caregiver definition will apply, are due in less than 2 months. Every state will make its own implementation choices. Some states will look back 1 month of compliance at application. Others will look back 3 months. Some will verify every 6 months. Others could verify monthly. The difference between those choices will determine whether millions of people keep or lose their health coverage. This situation is going to change fast, and YouTube notifications are not reliable enough to keep you informed when your health insurance is on the line. That is why I am asking you to do something right now. In the description below this video, there is a link to join the Global Senior Alerts official WhatsApp channel. When you join, you will receive real-time alerts whenever there is a change to Medicaid rules, Social Security payments, pension regulations, bank policies, or travel rules that affect seniors. No spam, no selling, just the facts, delivered the moment they matter. You will also be able to download our free Senior Benefits Protection Guide. It includes a checklist of every document you need to protect your Medicaid coverage, a state-by-state tracker for work requirement implementation dates, and a template letter you can use to assert your caregiver exemption. If this video helped you, I need you to do 3 things. Hit the subscribe button, share this video with anyone you know who is a caregiver, and leave a comment below telling me your state, because I am tracking which states are moving first, and I will make a follow-up video addressing each one. Remember what happened in Arkansas. 18,000 people lost their coverage, not because they didn't qualify, but because they didn't know what was coming. You know now. Do not be the person who finds out too late. I am Edward. I will see you in the next video. And please, take care of yourselves, because this country certainly needs you to keep taking care of each other.